Before you drink your next glass of water thinking that it's going to thin your blood and prevent clots, I need to tell you something that might completely change how you think about hydration. I'm Dr. Sumit Kapadia, vascular surgeon, and I have operated upon hundreds of blocked arteries, removed so many clots, and here's what I can tell you with absolute certainty. Water does not thin your blood the way you think it does. The advice you've been following, it might be missing the real story entirely. In the next 8 minutes, I'm going to show you exactly what water actually does to your blood when dehydration becomes dangerous, and the one thing that prevents clots better than any amount of water ever could. Let me start with something I hear in my OPD almost every day. Doctor साहब मैं रोज 4 से 5 लीटर पानी पीता हूँ. Blood thin रहना ही चाहिए. And I understand why people think like this. We have been told for many years that if you drink more water, your blood will become thin and you can prevent heart attacks and strokes. But here's the medical reality. Your blood is not like the dal that gets thicker when you don't add enough water. It's a complete living tissue with red cells, white cells, platelets, proteins and plasma all working together in precise balance. Yes, when you are properly hydrated, your blood flows normally, but when you are dehydrated, it does become slightly more concentrated, and it may be concentrated, but it may not become as thick as a ketchup would. The dangerous part would be focusing only on water intake while ignoring the real causes of blood clots, and that can give you a false sense of security. Now let me show you exactly what happens inside your blood vessels when you become dehydrated. Your blood is roughly around 55% plasma, which is mostly water, and 45% cells. When you lose water, your plasma volume drops slightly. The same number of red blood cells are now suspended in less fluid. Think of it like this. Imagine you have a glass of lassi, normal consistency. Now if some of the water will evaporate, then the remaining lassi becomes much more concentrated. Same ingredients but less liquid. That's what happens to your blood. It's not that new clotting factors appear. In fact, everything becomes slightly more concentrated. Your heart has to work a little bit harder to pump the more concentrated blood. Circulation does slow down marginally, and yes, in extreme dehydration, this can contribute to clot risk. But, and this is crucial, serious blood clots are never always caused by dehydration alone. They happen because of 3 specific factors that most people have never heard of. In vascular medicine, we use something called as the Virchow Triad to understand how blood clots actually form. 3 factors, and all 3 usually need to be present for a serious clot to develop. Factor number 1 is slow or stagnant blood flow. That happens when you sit for long hours, either in a flight or you are bed rest after a surgery or a trauma, and there is prolonged immobility. Dehydration can contribute to this, but it's usually not the main cause. Factor number 2 is direct damage to the blood vessel. This can come from smoking, high blood pressure, diabetes, inflammation, or even trauma. Water intake has zero effect on this. And factor number 3 is hypercoagulability, which is your blood's increased tendency to clot. This can happen with certain medications, problems like cancer, genetic conditions, or hormonal changes. Again, water alone does not make any change into this. So when someone tells me that they are drinking 5 liters of water every day to prevent clots, but they are sitting for 10 hours a day, smoking, having uncontrolled diabetes, and take no other precautions, then they are focusing on the wrong factor. Hydration matters, but it's usually the least important of the 3. Let me tell you about a patient I saw last year from Bangalore. He was a 52-year-old software engineer who had come all the way from Bangalore to show me because he had developed deep vein thrombosis and with painful swollen leg, had already been under treatment there, but he came to me for my opinion after seeing our videos. And his only question was that, doctor, I sit on my desk all day, but I keep 2 bottles of water with me so that I drink water every hour. And the question I asked was, how often do you get up from your seat? and he didn't have an answer for that. So the problem in him was not the water intake. The problem was 10 to 12 hours of sitting continuously without any breaks, and yes, smoking and having coffee in between. So remember that only water will not prevent blood clots. You have to be careful about the other factors as well. Let me now address the most common water and blood clot myths that I hear. Myth number 1, more waters equals thinner blood equals to no clots. The reality is proper hydration maintains normal blood viscosity, but excessive water does not make your blood thinner. It can actually dilute essential electrolytes and create other problems. Myth number 2, if I drink enough water, I don't need to worry about long flights or sitting all day. But the reality is that immobility is a mechanical problem. Blood pools in your legs when you don't move. No amount of water changes that physics. Myth number 3, dehydration is the main cause of heart attacks and stroke. See, heart attacks happen when coronary arteries are blocked by atherosclerotic plaque. Stroke happens when brain arteries are blocked. These are structured inflammatory processes, not just hydration issues. The truth is that adequate hydration supports healthy vascular disease. The truth is that adequate hydration does support healthy circulation, but it's not a magic bullet against cardiovascular disease. And there's something that prevents clots far more efficiently than any amount of water. Movement, physical movement, that's it. Every time you contract your calf muscles, walking, standing, and flexing your feet, you activate what we call as the muscle pump. Your calf muscles squeeze the deep veins, pushing blood from your leg towards the heart. That mechanical action is far more powerful for preventing clots than any amount of dietary intervention. It directly addresses the stagnant flow. It directly addresses the stagnant flow component of Virchow Triad. On long flights, I tell my patients to get up every 2 hours, walk to the bathroom, do calf raises in your seat, flex and point your feet. When you are at work, set a timer. Every hour, stand up and walk around. If you are standing, make sure you walk around or do calf raises in between. This simple mechanical action of moving your legs prevents more clots than drinking extra water ever could. But there's still the question of how much water should you actually need. And here's the right amount of water for healthy circulation. For most healthy adults, 8 to 10 glasses daily, about 2 to 2.5 liters, maintains normal blood volume and supports all your body function. But if you are in hot water, exercising, or have certain medical conditions, you may need a more higher intake, maybe around 3 to 4 liters. But drinking 5 liters every day, for most people that's unnecessary and just dilutes important electrolytes. So here are signs that will tell you whether you are properly hydrated or not. If your urine is light yellow and not dark, you're not constantly thirsty, you don't feel dizzy while standing up, your skin springs back quickly when pinched, and most importantly, let's learn about when to worry about blood clot risk. If there is prolonged immobility, if you are traveling for longer period, you are in flights for long hours, you are on bed rest, or there has been a recent trauma or a surgery, you have active cancer, you are smoking, you have uncontrolled diabetes and high blood pressure, or you have a family history of clotting disorders, these are the risk factors for which you should talk to your doctor and identify if you need some kind of clot prevention strategies. You can screenshot this right now, which is our clot prevention checklist. Move every hour, calf raises, walking, ankle flexion. Stay adequately hydrated, 8 to 10 glasses daily. Don't smoke. Manage diabetes and blood pressure. Wear compression socks if you go on longer flights. Get up and walk every 2 hours during your travel. And know your family history. You can screenshot this, save it, and share it with someone who travels frequently or sits for long hours. This checklist can prevent more clots than any water myth ever will. For those who are enjoying and gaining information from our videos, We have a number of courses on how to improve your circulation and what to take care for your vascular health. Do check out the link in the description where we highlight which courses are available. They are quite informative, giving you a complete overview of diet, lifestyle, exercises, how to take care of your circulation.